When I was first diagnosed, I guess I was first relieved that I knew what it was, because before I just didn't know what it was. I just knew I was in pain and I was getting mobility issues, especially in my hands and shoulders and elbows, and I guess there was a slight relief, but at the same time, as soon as I got to my car, I cried. I think that, you know, I was sad, I was frustrated because I was really worried at that point on what was going to happen. I've had to back off quite a bit more and rest a lot more, take times in between games, stretch more. It has been an adjustment from that standpoint. My name is Tony and I am living with rheumatoid arthritis.
Rheumatoid arthritis is an autoimmune disorder that leads to painful inflammation of the joints. Currently, 1 out of every 100 Canadians are diagnosed with this type of arthritis. Females are 3 times more likely to be diagnosed than males, and this is primarily due to hormonal fluctuations, but researchers aren't 100% sure. The average age of onset of rheumatoid arthritis is 27 years old and is increasing with age. Currently, 46% of the individuals diagnosed with RA are older adults. This number is supposed to increase to 60% of individuals diagnosed with RA by the year 2040. RA can lead to moderate to severe disability in basic activities of daily living, like being able to brush your teeth, tie your shoes, and go to the bathroom. This is especially important in older adults because we want to maintain independent living in their homes for as long as possible.
Their immune system is actually starting to attack their own body. Often when people first start to feel like they've got rheumatoid arthritis, they might have sore hands, they might have sore feet, they may feel like they're getting the flu, or they feel really tired. There's a sense of fatigue.
Signs and symptoms older adults should be aware of include firm bumps or tissue under the arm, called rheumatoid nodules, weight loss, joint pain, joint tenderness, joint swelling, joint redness, joint warmth, stiffness of the joints, particularly in the morning, polyarthritis, meaning arthritis in multiple joints, depression, fatigue, fever, and symmetrical pain, meaning pain on both sides of the body. Symptoms can vary between individuals and can be flared up by certain activities. Flare-ups are likely worse in older adults. The difference between rheumatoid arthritis and osteoarthritis is that rheumatoid arthritis is an autoimmune disorder, while osteoarthritis is caused by wear and tear on the joints. An aggressive multidimensional treatment at the onset of RA is most effective. Treatment includes a combination of medications, including NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, corticosteroids, disease-modifying anti-rheumatic drugs, and painkillers. Inflammation-reducing nutritious foods, physiotherapy and occupational therapy, achieving and maintaining a healthy weight, and participation in self-management programs.
Exercise is critical. If someone gives up moving, then sometimes it's not, over time, it's not going to be the arthritis that restricts the movement in their joints. It's going to be because their muscles have started to atrophy, and that's going to cause them a lot of loss in their functioning and can significantly increase their pain.
Even though exercise can be uncomfortable with rheumatoid arthritis, you can be assured that you're not going to be doing any damage. Therefore, it's important to have a personalized exercise program catered to the individual's symptoms. Finding a time where you can exercise where your symptoms are minimal is really the best time that you can be exercising. By performing aerobic, resistance, balance, and flexibility exercises, we can increase our strength needed to prevent falls and maintain daily activities. Aerobic exercises get your heart beating and blood pumping throughout your body. 3 to 5 days per week. 30 minutes per session, or 3 10-minute sessions. Low to moderate intensity. If walking or biking is too strenuous on your joints, try performing exercises in water. Resistance exercises help maintain muscle mass and strength. Some medications, like corticosteroids, could weaken bone, leading to osteoporosis with long-term use. Maintaining bone mass or slowing deterioration of the bone through resistance training is very important. 2 to 3 days per week. 10 to 20 repetitions per set. 2 to 3 sets per exercise. Exercises should be related to daily activities. Flexibility exercises help increase movement in your joints. Perform static stretches after each exercise session. Each stretch should be held for approximately 30 seconds or until discomfort is felt.
I have seen people who were in wheelchairs able to get back to walking again. I've seen people who are off work being able to get back to work.
Now that I've learned a lot more on it, I feel that I'm able to sort of live life exactly almost as I was able to before, with just minor adjustments, with just a better understanding of what I can and can't do.